Hello, everyone. A warm welcome to CECCRe 2.0. Today, I'll be talking about the MAAC charts, a simple tool for early diagnosis of early childhood caries. In this presentation, I will be talking about why we develop MAAC charts, what are MAAC charts, how to use MAAC charts for early diagnosis, our experiences using them, and I would like to conclude with my thoughts. Now, why did we develop MAAC charts, or what made us develop MAAC charts? Now, in the past, we have conducted a systematic review. Most of you might be familiar with this paper. This was an extensive systematic review which revealed a total of 123 risk factors. But the most important and most interesting conclusion of this paper was that enamel defects was one of the most strongest risk factors associated with early childhood caries in high or upper middle income categories. Recently, there was another umbrella review which analyzed 15 systematic reviews on risk factors of early childhood caries. This paper too concluded and confirmed that enamel defects are indeed one of the highest risk factors of early childhood caries. Now, a few years back, we did an epidemiological study to find out the prevalence and pattern of ECC in rural South Indian population using ICDAS. Another interesting finding here, what we found was the prevalence of non-cavitated lesion was 50.3%. This reports demonstrated that almost equal number of non-cavitated and cavitated lesions exist. The prevalence of enamel defect in primary dentition has been reported to range from 25% across general population in the USA, India, Brazil, and Australia, to over 70% preterm children and indigenous population worldwide. The high prevalence of enamel defects reflects the vulnerability of this developing teeth to environmental changes during gestation and early childhood. Now, what we derive, the critical points which we derive from these papers are that enamel defect or enamel hyperplasia is often unrecognized as initial stages of dental caries by parents and healthcare professionals, including dentists. Hence, parents do not feel the need for dental checkups. Parents are oblivious that at this stage, ECC is reversible. Now, going back to the facts, enamel defects are defined as disturbances in the process of apposition and mineralization of dental enamel and may be manifested as enamel hyperplasia or opacity. Mind you, enamel hyperplasia involves only enamel, not the dentine. Now, enamel defects can appear as demarcated or diffuse, or demarcated and diffuse are the same tooth. Now, in my experiences, we found combinations. We also found diffuse and demarcated. Now, what are MAAC charts? Now, you must be wondering what does MAAC stands for? While the word MAAC is derived from the first letter of all the authors involved in the development of these charts. The MAAC charts comprises of 3 charts. Here you see chart number 1, which shows the anterior tooth showing different types and stages of enamel defect and ECC. Now, if you see the first 2 rows shows mild ECC, the middle 2 rows shows moderate ECC, and the last 2 rows shows severe ECC. Now, these charts help us to explain to the parent that if untreated, mild becomes moderate, moderate becomes severe. Now, chart 2 shows various stages of ECC and its progression if untreated again. Now, chart 3 is an important one because it shows the stages of enamel defect pre and post treatment of ECC. Now, these charts help us to explain to the parent that while ECC is treatable in all stages, yet the extensiveness of the treatment and the cost of the treatment becomes higher as we progress from mild to moderate, moderate to severe. Now, how to use MAAC charts for early diagnosis of ECC? Now, the MAAC charts were developed for our current project called STOP, which is the Smile Train Oral Health Project. In this project, we have set up early dental homes for 72 infants with cleft lip and or palate. Now, these 72 infants are currently under the model Sustained Anticipatory Guidance or SAG. Our only aim is to bring them cavity free. Now, when the parents visit us for the first time or in their subsequent follow-up visits, what we do is we show them the MAAAC chart, and we explain to them and we tell them that if they are neglected, the mild becomes moderate, moderate becomes severe, and the harder it becomes to treat. Now, following that, we also send the MAAAC chart with an audio, which I'll be playing in the next slide, with an translated to English. Now, this is the chart we share, the chart 1. And the audio is recorded in a regional language so that parents can understand what the MAAAC chart is.
வணக்கம், நான் ராமச்சந்திரா பல் மருத்துவமனையிலேருந்து டாக்டர் பேசுறேன். நாங்க இப்போ உங்களுக்கு வாட்ஸ்அப்ல அனுப்பியிருக்க மேட்ச் சார்ட்டை ஆல்ரெடி நீங்க இங்க வந்தப்போ பார்த்திருப்பீங்க. உங்க குழந்தையோட பற்களை நாங்க சொன்ன மாதிரி காஸ் பீஸ் வச்சு தொடச்சு அப்புறமா நாங்க கொடுத்த ஃபிங்கர் பிரஷ் வச்சு சுத்தம் பண்ணிட்டு இருக்கீங்கன்னு நாங்க நம்புறோம். உங்க குழந்தையோட பற்கள் ஆரோக்கியமாவும் சுத்தமாவும் வச்சிருக்கிறது உங்க கையில தான் இருக்கு. இப்படி சுத்தம் பண்ணாம உங்க குழந்தையோட பற்கள்ல அக்கறை காட்டாம விட்டுட்டீங்க அப்படின்னா இந்த சார்ட்ல கொடுத்திருக்க மாதிரி அந்த 3வது 4வது வரியில இருக்க மாதிரி கொஞ்சம் மோசமாவும் இல்ல அந்த 5வது 6வது வரிகள்ல இருக்க மாதிரி ரொம்ப மோசமான நிலை அடையறதுக்கு நிறைய வாய்ப்புகள் இருக்கு. இந்த சார்ட்ல இருக்க மாதிரி உங்க குழந்தையோட பல்லுல ரொம்ப வெள்ளையாவோ இல்ல மஞ்சளாவோ இல்ல புதுசா ஏதாவது மாற்றம் தெரிஞ்சிருந்துச்சுன்னா எங்களுக்கு உடனே தெரிவிக்கணும். நீங்க எவ்வளவு சீக்கிரமா தெரிவிக்கிறீங்களோ அவ்வளவு சீக்கிரமா நம்ம அந்த பல் சொத்தை பரவாம பாத்துக்கலாம். உங்களால நேர்ல வர முடியல அப்படின்னா எங்களுக்கு ஒரு போட்டோ எடுத்து அனுப்பலாம், இல்ல நீங்க எங்களுக்கு வாட்ஸ்அப் வீடியோ கால் மூலியமா தொடர்பு கொள்ளலாம். உங்க குழந்தையோட வாய் மற்றும் பல் ஆரோக்கியத்தை பராமரிக்கிறதுக்கு நாங்க சொன்ன அறிவுரைகள் எல்லாத்தையும் பின்பற்றுங்க. நன்றி.
Now, these charts are explained in the regional language, and following that, many parents have got back to us with pictures of the infants whenever they had doubt or suspicions of early childhood caries. So, along with the video and the MAAAC chart, we also send this picture to the parent to show them how to lift the lip and how to examine them once a month at least. And along with that, we also tell them that you can take a dry piece of cotton and wipe the tooth to appreciate the early signs of ECC better. Now, in our experience, what we found out that how MAAAC charts aided in parent reporting of early stages of ECC. These are the numbers as you can see on the table. So the total children we did among the 72 children under the SAG model, we have 52. The MAAAC chart shared and explained to all the 52 of these infants. Among the 52, 31 parents reported with pictures via WhatsApp, and 2 parents reported to the cleft clinic on having doubts of early signs of early childhood caries. Now, what we observed after sharing this MAAAC chart is that we found that there were almost 63.5% of parents diagnosing and reporting to us with early signs of early childhood caries. Now, among the 63.5%, we have 6% reporting, like I said earlier in the slide, to the cleft clinic, and the 94% uses WhatsApp to report back to us. Well, now I would like to conclude my presentation by sharing these pictures. So what I want to emphasize here is when we can keep a warning label in food, in a cigarette packet, or in a McDonald's box about the consequences of having that item. Why can't we keep a warning label maybe in a toothpaste box? As you can see, this is just to represent my idea how we can spread awareness through these products and all the infant products or the teeth related products, we can create awareness, and we can show the parent what to look for, do just 1 minute check, and to warn them that if negligence of milk teeth in early stages can cause severe irreversible damage and added expenditure in future. We can also keep the warning label or tips or whatever we can put in the vaccination schedule or even in baby products. Now, in a recent paper in Lancet on smart apps for self-reporting clinical information, this was a paper published recently in Lancet. While we can all agree that we don't need a mobile app to self-report COVID, we all know the symptoms and clinical features and consequences if untreated. Perhaps it took only a couple of months to create this awareness. The question, therefore, is why not do for ECC? In developed and LMIC countries where barriers are like lack of healthcare or manpower limited, diagnostic tools for parent reporting such as MAAAC charts can play a major role to significantly reduce caries burden in children. Easy to understand, very light, easy to carry, most inexpensive, easy to share, and easy to explain. You just need 5 minutes of your dedicated time. Sometimes something we should all ponder upon. Now, last, I would like to conclude with a feedback of a parent who had reported to the cleft clinic, and this is what she wanted to tell me. Now, thank you all for your undivided attention. At last, I would like to acknowledge my cleft team members who have been very instrumental in this process. And I would also like to thank Team CECCRe and my gratefulness to Professor MS Muthu for giving me this opportunity. Thank you.